get started with, and this was the back one. Okay, I'm just checking which security groups they're in. Yep, clinical and clerical. Okay, that should give us what we need. Alrighty. So when you first log into Denticon, the first screen that you guys are going to see is this screen. You're going to notice your name up at the very, very top left corner. Do you see how it says Denticon, patient window, welcome, and then it has the name of the user? The system does track who's logged in, so it is important when you're doing documentation that you're under the correct login. And then based on the users that's logged in, you'll notice that just below that black line, there's a blue line with the word scheduler, patient, transactions, charting. If you keep moving across that line, you're going to see a prompt that says office, and then there's a drop-down arrow. Does everybody see that office with the drop-down? Okay, if you click the drop-down, what that's going to show you is what offices this user has access to log into. So right now, this user can only log into this one location. Some users will have the ability to log into multiple locations because they work in more than one office. The system doesn't know which office you're physically in as far as doing a login. You're defaulted to a home office, but if you're not working in your home office, you have to tell the system which location you want to document information for a patient. So it's nice for doctors who travel between locations because they can go in and document things for the appropriate office if they log into that office. Directly to the right of the office is the word help. That is a place that you can go to learn about different information. So if you click help and help portal, so drop down to the help portal. And let's say you want to know about charting, you can see that we have a bunch of categories that are here, but you can talk about, you can ask a question in the search field, or you can go directly to the category that is listed below to get more information about any subject. So if you go to clinical records and charting on the first column, second to the last button, so it was in the first column, second to the last button. Yep. When you click on that, then once you click on the category, it's going to give you, how do I access the charting module? How are the teeth arranged? What are the default colors? So it just talks about little topics, and you can click on any one of those, and then there's also videos that will show you information. But the one that's important here is, how can I change an adult permanent tooth to a primary or deciduous baby tooth? So if you click on that, then the system will tell you how to change that tooth dentition, and it shows all of the information of how to change it. Does that make sense? Okay. So the other thing that's available in this, we're going to go ahead and close out of this with the red X at the top. And then the other thing that happens is we frequently make updates to the software. We just made a big recent change to our clinical charting software. And so under the help button, you're going to see there's a drop down. The first option says release notes. So this will kind of give you an idea of how frequently we add new things to the system, and then you're able to see the release notes that talks about the new information that's available within the system. So you can click on any one of those hyperlinks, and it will take you to that set of release notes. Now those can be printed or just reviewed to look at them. Okay, so up in the top section, we're just going to, where you're at now on the help, there is a search patient box with a little arrow. Go ahead and just click that little arrow for me. It's down below that one. So do you see where it says search patient and then there's a box with an arrow?
I'm sorry, you guys, there's a lot of noise. I do apologize. We can hardly hear Tracy.
Okay, do you see there is right below the office name, you'll see a globe, you'll see two people, then you see a box with a printer, a little printer with a piece of paper next to it. Then next to that's a drop down of recently accessed patients. Then right next to that's a search patient box. And then right next to that is an arrow. Okay, click that arrow for me. Okay, so this is your, what we refer to as your landing page. This is the page that you're going to first access when you log into the system. So this is where we look, this is basically, if you think of paper charts, it's a file cabinet with all of our patients listed in it. So if you'll go ahead and type a last name that's fairly common to your geographical area, so it can be Smith, Jones, Martinez, whatever is a common last name. And then hit the search button. So you're going to notice that we have 3 patients with the last name of Jones. We have Gracie Jones, Samantha Jones, and Stix Jones. So those are all 3 patients. We can see that they have a birth date listed. We see their phone numbers. We see email addresses. This CH is a patient type. So patients can have a patient type of child, or they could have a patient type of Spanish speaking, free Medicaid, whatever we define patient types as. The provider will show the doctor that has been assigned to that patient that they normally see. And then the next recall information would show you when they were going to be due for their next recallable item. And then to the right of that, it will tell you what location they're registered in, what office they're registered in. And then it will show if they're an active patient or an inactive patient. So all 3 of these patients are active patients. So let me go to the schedule, and we have information in there, which is awesome. I'm going to put these 2 patients on there so I can show you this. Oh, it says that the operatories are there, but no providers are assigned to work in them.
Okay, so I already created the operatories. Let me just go ahead and find it now.
Okay. Okay, so when we're looking at this patient information, one of the things that we can do is we can also look by date of birth, or we can look by telephone numbers. So the radio buttons where it says search by, and then it currently says last name. If you change that to birth date, and then we put in the birth date of 03/06/2013. So change your radio button up above to birth date. And I'm not sure which one is caller 1. There's a lot of background noise coming from that particular microphone. Oh, okay. Can you see, okay, so date of birth, and let's go ahead and put 03/06/2013. And you will have to put the slashes in. If you don't, it'll yell at you. And then hit the search button. And then if you hit the search button, then it should give you all the patients that have that date of birth. If it winds up that there's only 1 patient with that date of birth, it takes you directly into their patient overview. So if you've used like Dentrix before, that would be considered the family file. Or EagleSoft would be the account file. So depending on what software you've used in the past, you can kind of reference this. We call this the patient overview. So in the patient overview, I'm able to see the patient's name and the demographic information for the patient. I'm able to see how old the patient is, the gender of the patient. I can see in the upper left corner of this screen, it says Gracie Jones, and then it does say that her home office is Ontario. So she normally goes or is treated in the Ontario office. And then right below the home office, you can see the provider that they usually see, and then also how they heard about us. Below that top section where it says patient information, we see the section that says recalls. Do you guys see the one that says recalls? So at the top left, it says patient information, and then right below that, there's a new section that says recalls. So the recalls will allow us to see what the patients due for next and when they're due. Now this patient has the word recalls, but then we see a display of an exclamation point. What that's telling us is that the patient is out of sync on their recalls, they're past due, or they have no future recall. One or the other, whichever it is. Okay, then down below is appointments. Now these are past or future appointments that the patient had. So we can see that the patient was in April of 2017 and they were checked out, so they came to the office. And then we have another appointment on November 12th, and they were scheduled for that one, but they did not come in. We didn't check them out or anything. You can see that. There is not a status update for that particular appointment. To the right of the screen at the upper right corner, it will tell us the responsible party, so who's responsible for this patient's account. And below that, we see their insurance type. So this particular patient has Denticon as the insurance, and she's the only person on her family account. So no one else is on this account with our patient, Gracie. And then below that, it gives us billing information. So that's going to show us what the patient's coming in, what their balance is, and it's just a high level of the balance. It's not going to be a full breakdown, but it will show us what is currently owed. Okay, now if we go to the scheduler, we're going to go ahead and click the button that says schedule, and it's at the top left corner. And with this schedule, what we're going to see is any appointments that have been booked for the patient. Any patients for the whole day, actually. Now, when you're looking at the schedule, you're going to see several columns. These are all the columns that you guys currently use in the organization. And then along the top of the screen, you'll see that it says scheduler. And if you click the word scheduler in the upper left corner, you'll see a drop down. Perfect. And then this is ways that we can make a new appointment, we can modify an existing appointment, but we have fast, easy ways to do all of that. And in Denticon, there's probably 3 or 4 ways to do the same thing. And I'm going to show you guys the most common 2, probably. And then if you find other ways to do the same thing, it's not wrong. It's just a choice that you get to make on how you want to access different areas of the software. All right, so in the next section says patient. I'm not going to have you click on that. The next one is views. So the views are either a daily view or a weekly view if you click the drop down. And the weekly view may yell at us just because there may not be providers set for every single one of these operatories. So we may not be able to see that weekly view. But what the weekly view would do is show you your current view for 7 days. So you could glance at your calendar and see how full your schedule is for the next week and know where you kind of need to fill slots or see if you're going to have a break in your schedule. The next one is providers. And if you click the individual providers, then you're going to see the operatories based on when those providers are scheduled to be in the location. So the white areas mean that the appointment time is available, and the gray background is when the office is closed or the provider is unavailable, depending on the view. Okay, next to that, we see a thing called appointment reports, and we're not going to worry about that right now. If we go to the HIPAA, do you see where it says HIPAA in the upper section? If you look at the 2 patients that are scheduled today, one is child 2, one is child 1. If you click the HIPAA checkbox, so just go ahead and click the HIPAA checkbox for me. Perfect. Now, do you see how the patient names disappear? So if you look down at the appointments, the child 1 and child 2 names are missing. If you uncheck your HIPAA checkbox, those names will reappear. Okay? And then the next section is a checkbox for production view. So if we book appointments for specific types of procedures, then we're able to see the color for that particular appointment. So go ahead and check production view. And you're going to see that child 2, the appointment is red because the appointment type is an emergency. And child 2 is green because we are indicating that this is a recall and they have insurance. So the appointment types are based on decisions that your organization has made for what they would like to identify for appointment types. The quick save view, we're not going to use that in the back. That will be pretty much just used in the front area. And that is used when I book an appointment and I need to add some additional information to it. Maybe I need to go check with the doctor before I complete the appointment, or I need some clarification, or I just get busy and I need to get out of this appointment so that I can book something for the patient in front of me. You have the ability to quick save an appointment. And when you do that, the system will call those out so that you can go back in and identify which ones were your quick saves, and so you can fix them and update them to what they need to be. And I didn't quick save either of these, so the quick save will be empty for us today. Now, next lower half of the toolbar, you're going to see an arrow pointing to the left. You're going to see 4/5/2019, then a picture of what looks like a calendar, and then an arrow pointing to the right. So each click on the left arrow will move back 1 day on the calendar. Each left click on the right arrow moves forward a day. And then if you click the calendar itself that's in the middle of those arrows, this lets you advance to a specific day. We have quick jumps. We can jump a week, we can jump 2 weeks, we can jump 6 months. So if you'll go ahead and click the arrow that says 6 months, so it's the arrow forward next to the 6 months, you'll see that the calendar will jump us to October, and then we just have to pick a day in October. It highlights the date nearest, which is a Saturday, the 5th. So you're actually going to pick like the 7th or the 8th or whatever day you want to book the appointment for. And when you click, it jumps the calendar to Monday, October 7th. And where you see that is in the black area. Do you see the black area of the schedule right between the hot pink and the dark blue, there's a black area of the screen. And if you hover to the right, you're going to notice that it says Monday, October 7th, 2019. So that's where your display will be to tell you what date you're currently viewing. Now, if I don't know what today is, I've forgotten, I don't know what the date is exactly, I can click on the little box with the star. So if you find the little box with the star on the blue toolbar area, that is going to take you back to today. So today's date, we've marked that as a favorite so that we can get back to it quickly and easily. Now the next three icons we're going to talk about, but we're not going to click them yet. We will be doing that today. The first one is the house. That takes us back to that screen that we saw a few minutes ago. The little tooth will take us to the patient's restorative chart. And the little tablet is where items will be, it's like a document center where we can take, for example, the eligibility. We can take a screenshot of the eligibility screen for Denticon. So we know that the patient was eligible on a specific date. We can scan in copies of their eligibility cards. We can scan in mom or dad's driver's license. So that's the sort of information that's going to go under that little tablet. So that's going to be patient information. The next icon, oh, let's go ahead and go back to the schedule. Okay, so the arrow pointing upward, if you were looking at the end of the day, this would just take you to the beginning of the schedules for the day. The 1, the 7, and the refresher bin are all ways of looking at the schedule. So we have a single day view, a weekly view, and we have a refresh. So if you pick a provider up top, so go ahead and click for your name under the provider dropdown. So providers, and find your name. And now click the 7, the box with the 7 inside of it, and what you're going to see is your schedule for a week. So the first section is going to be Wednesday, the next one will be Thursday, the next one would be Friday. Does that make sense? Okay. Now if you click on the box with the 1 inside of it, that will just take you back to the single day view. Okay. The next icon over is a box with a refresh symbol in it. And what that does is if you had picked a specific provider's view, you could just go back to your normal view. I don't see you guys using that a ton because you're really going to use the daily view that the organization sets up because you want to see every column. Then one that you're hovering over now is a refresh. So up until a week ago, the schedule did not auto refresh. So if you had placed your schedule up on a screen and you walked away for 20 minutes, when you walk back, that same schedule will be displayed. Now we have a timer, and it's in the upper right corner. Do you see where it says auto refresh timer and it's set to 5 minutes and it's in yellow? The 5-minute time is in yellow. So that's going to count down and tell you how many minutes before it refreshes again. And then you can use those 2 large refresh symbol arrows to click it if you want to refresh it sooner than 5 minutes from now. Now, if you're a front desk person, you're moving in and out of the schedule all the time. So anytime you hit the word scheduler or you move into the appointments and you save something, that automatically refreshes it because you've made a change. It's just when you're sitting on the schedule without moving that you would have to be concerned about refreshing. Does that make sense?
With you.
Okay. So the next thing that I want to talk about would be the scissors, that's a cut, copy, paste. And the big X is a delete. We want to avoid deleting appointments. If we delete an appointment, we have no history of the appointment. So what we would prefer to do is cancel the appointment or mark the appointment as missed if they no-show. so that we can track those patients, and then we can also put them onto a report that can be run that shows a list of all the patients who canceled and didn't reschedule their appointment, for example. Okay, the S, the C, the U, the L, the R, the A, and the O, those are all appointment statuses. So if you select child 2, just single left click on the appointment, and you moved your mouse when you, and so this is a good learning, we want to talk about this, so this is perfect. When you click with a left mouse, oh, you lost my window. Okay, so when you left click, if you move your hand, the system's going to try to move the appointment. So it is super easy to move an appointment with just a left click, hold and drag it to a new spot on the calendar, and that's what the system thought you wanted to do. So if you are enter queening and you don't read this message, you will move the appointment to a new time. So it's really important to watch that message, because what usually happens is we move the appointment up to 2 o'clock in the morning, and then you can't find your appointment because you're really not looking at 2 o'clock in the morning on your schedule. So we want to make sure that when that window pops up, that if you don't want to move the appointment, you're just going to click cancel. Another option, because I have a problem, I personally have this problem, I always move my hand when I left click on the appointment, unless I'm really focused and not in a hurry. So your other option is a right click on the appointment. So go ahead and right click the appointment. And then do you see at the bottom of this drop down where it says set status? So you can move your mouse all the way down to the set status prompt, and then move over to the set as left message, for example. So now what you're going to see is this appointment now, instead of just having a white box with the black S inside of it, it now has a green box with an L. So what that means is we left a message regarding the patient's appointment, but we were unsuccessful in confirming it. Does that make sense to everybody?
Yeah.
Okay. So let's go ahead and click on this appointment one more time, and I want you to right click and set status as confirmed. So right click, set status as confirmed. And then go ahead and say okay. So that pop-up box was saying to you, hey, there's more than one patient in this family that's coming in today. Do you want to confirm all the appointments for this family? So by clicking OK on the box that you replied to that popped up, you confirmed the appointment for both child 2 and child 1. Does that make sense?
Mm-hmm.
Hi. So you have two choices. You can single left click on the appointment and then use those little colored buttons up top, or you can right click and select the option from the drop down. So either one is appropriate, doesn't matter which one you use. Now what I want to talk about is the symbols that are on this appointment. So if you'll notice, this patient has a C, and then do you see that little IN that's next to the C? If you hover over the IN, what you're going to notice is a little call out box that says, hey, the patient type is insurance. So the patient's account type may be insurance, it may be Medicaid, it may be a discount plan, maybe it's a cash account. So this is where you're going to see that information. Now below that, there's a red cross. So the red cross is only visible if the appointment is highlighted. So go ahead and either right click on the appointment or single left click on the appointment. It doesn't matter to me which one you do. Now go ahead and hover over the little red cross. Go ahead and single left click it, move away with the mouse and move back. For some reason it's not acknowledging it. So single left click and then come back. And I don't think it took the click because it doesn't show a red box around the appointment. Okay, so let's click one more time because I'm not seeing the red. There you go. Now go hover over the red cross. And you should get a call out. It's being naughty to us. Move your mouse away and then move it back again. And then move it back over the red cross one more time. It should call out the what this patient's allergy or medical alert is. Okay, it's being naughty. I don't know why it's being naughty to us, but that's what should happen. I'll let you guys play with that when sometimes the WebEx kind of skews your screen just a little bit and you're not hovering exactly over it, even though it looks like you are. So we're going to assume that's it, and once we're done with the WebEx, then the GoToMeeting, then you'll be able to kind of take a look at that. But while we have this window open, go ahead and left click on one of the appointments again and leave your mouse still. Okay, so if you look at this box that popped out, you're going to see that okay, so what I need you to do is just left click on the appointment, but then don't touch the mouse after the pop-up box comes out. There you go, perfect. Okay, don't touch the mouse. All right, so what you're going to see is you're going to get this call out box and it's going to tell you some additional information. So I can see that this is a 30-minute appointment. I can see that the provider who they're seeing today is also their doctor of record. I can see the appointment length. I can see that we're planning to do a limited eval. And there was a note that the admin team put on the appointment that says, hey, the parent wants us to check the eruption. So there must be a tooth coming in behind another one. So below that, you're going to see who created the appointment, which was me. And then you're going to see who modified the appointment, which is the user that you guys are logged in with. And then we see the value of the appointment. So this appointment is, we're going to charge $82, and we're expecting the patient will pay $50, and the insurance will pay $32. So below that, we see the word scheduled. It's kind of a grid. So you can see that this appointment was scheduled today at 9:44. Then we set the patient as left message at 9:45, and then at 9:46 we were able to confirm. So the patient called us right back. So as we are updating the status of the appointments, the system does track that, and so it's really easy for us to see how long the patient waited in the lobby before they were brought back and those sort of things. Below that, it will call out the fact that this patient is on a family account, and there are two family members that both have an appointment today. So two kids in the family are both scheduled today, and it will give you the name of the other patient, which is training child 1. And they're 7 years old, and they're coming in at 10:30 in another operatory. So that's going to let you know what time and with what provider that other appointment is for family members. And this is really good when you have the mixed families where there's different last names for each child. It's kind of easier to identify who's the family that goes together. All right, any questions on this call out box?
No.
Okay, if you do me a favor and double left click on the appointment, so 2 times left clicked. Or you can do a right click edit, either one. So a double left click on an appointment is not going to give you family file information. What it's going to give you is just information about this single appointment. So for this patient, you can see the production type. Do you see the little red box right next to the word emergency in the upper left section of the appointment window? It's a red box and it says emergency next to it. If you click that drop down where it says emergency, these are the other patient types that we could have put in. So we could use that they're cash, we could put recall Medicaid, you can pick any of those other types, and you'll be able to see that it's going to change the appointment color to match whatever option was chosen from this drop-down. The duration is directly across from the production type. Then we see right below the duration, we see the provider, who they were scheduled with, who their preferred provider is. In the far right-hand corner of this kind of gray area, we see the provider they're scheduled with. We also see their information about what that medical alert was, and it says that it's latex rubber, so they're allergic to latex. Below that, we have linked the procedure that we're going to be doing today to the appointment, which is the limited eval problem focused. And then down at the bottom of the screen, we see two tabs. One is a treatment plan tab, one is a quick add tab. So if the patient has a treatment plan, we can pull what we're appointing for today directly from the treatment plan. If they don't have a treatment plan for the items that we want to do today, we can grab those with a quick add and still link them to the appointment. All right, go ahead, and the save is kind of in a weird spot. It's in the middle of the screen right below latex rubber. You have a save, a close. They're little blue buttons. Perfect. All right, so once the appointment's saved, I want to talk about a couple of these other statuses. So we talked about scheduled. That happens by default. Every appointment's just scheduled as soon as it's made. We can set appointments to confirmed, unconfirmed, left message. So the other statuses that are available is R, which means they're in reception, but they're filling out paperwork. So you can't take them back yet. The A means they're available to go to the clinical area. And then the O means you've taken them back. So let's go ahead and set child 2 to available. So let's go ahead and select the appointment, and you can either left click on the appointment and hit A, or you can right click set status. Whatever's easier for you. All right, so that's how we would get to a patient's record. Now from here, where I want to go next is I'm not ready to go get my patient yet. I want to look at their health history and a couple of other pieces of information. So if I select the appointment so that I get that red box around it, then I can click the little house, or I can do a right click on the appointment and go to patient overview. Either one is appropriate, whichever you want to pick. So you may have to move up just a little bit and then back over to it because it didn't pick up. There you go, and then you have to go straight across. Perfect. All right, so this takes us back to our patient's overview that we talked about a few minutes ago. Couple of things that I want to call out that I didn't mention before. So do you see where it says patient information and then there's a little yellow, red telephone symbol? If you hover over that, you're going to see that the emergency contact for this patient is June Training, and she's the patient's grandmother. Now, if you hover over the next icon with the little blue person, you're going to see that the healthcare guardian is Dad Training. So Dad is not on this account. Mom is Test Training, and she is also the insurance holder. Dad is not part of this account. So this happens commonly when we have split families, and we need a place to be able to put the dad and his information, because the dad has the ability to call up your office and say, hey, I would like to know the status of my child's dental. What's their dental status? Do they have any cavities? They have the opportunity to call and get that. But what Dad doesn't have the right to do is call and get billing information on this child, because none of it relates to him. So it's not his account. He's not the responsible party or the person who's assigned to pay the bill. So he doesn't get that information. So this is just a place for us to put that extra information. And that's what we typically see it used for. You don't even have to use those sections if you don't want to. but that's what we see a lot of people use them for. All right, so now if you look down towards the middle of the screen on the left-hand side, you're going to see some blue text. So anytime you see blue text, it's a hyperlink, and it's going to take you to some extended information inside the patient's record. So in this case, we see the medical alerts is blue. So when you click on it, it will open up a health history form. And this is where the information came from that said that the patient had an allergy to latex. And it doesn't look like, Alice, that you guys have updated this yet. Is that correct?
I'm sorry, am I supposed to do update? I'm sorry, Tracy.
For the medical information, have you created a new medical history form yet? It doesn't look to me like we have.
You know, Dr. Chen did. She was looking over it. That was last week.
Yeah, she probably hasn't had a chance to finish doing the update. So once you get it updated, you do have to. And if she has done it, would you let her know that she has to proof and finalize in each office, just to make sure it takes effect?
Okay, we'll do that.
Perfect. She doesn't have to add it to each office. She just has to hit the proof and finalize. Okay.
Sounds good.
Okay.
Thank you.
Perfect. Thank you. Okay. So there are 3 sections in the medical information form. The section 1 is the alerts, things we need to be aware of. And you'll notice there's kind of a little scroll bar, so you can scroll down a little bit inside of these medical alerts. And then if you click where it says medical alerts, that's going to collapse that section. So if you collapse the medical alert section, so click where it says medical alerts, it'll kind of collapse it. And then you can click on dental questionnaire or medical questionnaire to see more information about those sections. Now you can leave the sections open, and you'll notice you have a scroll bar on the far right-hand side that you can use as well. I just don't like to scroll, so I like to know that I have the ability to use the little scroll bar or the collapse, whatever's easier for me at that moment. So both are totally appropriate, and you can use whichever one is easier for you. Okay, so right at the bottom of the screen, we do have the ability to have patients sign electronically if we have signature pads available for them to use. So we could have mom sign the health history form, and that would alleviate the need to scan. Now, if we don't have signature pads, we can still use the medical alerts section of this form, but we're going to want to make sure that we scan in their actual health history form that has been signed. Okay, now before we leave this section, I want to talk about that patient dashboard. So where you see medical information, you see the patient's name, you see their age, you see who's responsible for the account. There's also a place we could put a photo of the kid. Kids love photos put into their little charts. And then the next one is there's a circle with the letter I inside of it. If you click on the circle with the letter I inside of it, that's going to be a quick patient information screen is going to pop out. And from this screen, I can see how many future appointments they have, how many times they've ever been in for an exam or a cleaning. These are both new patients, so they don't have any history yet. But when we finish with them today, they'll have some history. All right, go ahead and close the little quick info window. And then to get back to the house, you have 2 choices. You can click anywhere in the blue area for the patient dashboard, or you can click the little house. You decide what's easier. And then that just takes us right back to the patient overview. Now, when we talked about appointments a little bit earlier today, appointments are straight down from the medical alerts. It says that this patient has an appointment on 4/5 at 10:30. And if you were to click on the hyperlink that is the date, so the 4/5, That's a hyperlink, and what that's going to do is it's going to jump you right to that appointment, and it will actually highlight it for you so that it's easy to find those appointments for the patients. Okay, any questions on what we've covered so far? Okay, so now we are going to branch off, and I'm going to do some clinical training, and then after we finish the clinical training, then we're going to do some front desk training. So depending on who needs to be in the room, that's the path we're going to take. How's that? All right, so to go to the clinical chart, the first thing I want to do is I want to set child 2 to inoperatory. So I'm going to go get them and bring them back to my operatory. So that sets it as inoperatory, and then I am going to go to the tooth, either the tooth or right-click, go to restorative chart. You can pick either one. Okay, so this will take us to our old patient chart. We have a new version of our chart, and I actually want us to go there. So if you go up to the word charting, up on the toolbar it says charting, C-H-A-R-T-I-N-G. And when you click that drop down, there's going to be an advanced charting new. So this is our new format that we just put into the system during the last week. So go ahead and click that. So this format is a little bit different, but it's easier to use than the previous format. So what I want to talk about here is, this is our restorative chart. You see where it says training child 2 in the upper left corner, just below the house? If you click the little circle with the double arrows, that will expand that window so that you can see more information. So it opens that whole dashboard up again. So you could quickly glance at their medical alerts while you're inside the chart. So you don't have to go all the way back out to the medical history. You can do it directly with the little circle with the letter I inside of it that we just saw a few minutes ago. Below that is the restorative chart. Pardon? If you click the little circle with the eye, your mouse is almost on it, just down just a smidgy hair. There you go. Click the little eye, yep, and then your medical alerts are right there. So that's just that quick overview of the alerts. Then we have a tab for perio charts, x-rays, and progress notes. So we can get to any of those sections of the clinical chart with just a really quick click. And a couple of these windows can be popped out so that you can see both screens at the same time. So just below restorative chart, perio chart, progress note tabs, we have a header. One is clear selection. Then we see last selection, ADA codes, we see draw mode, and some of these are grayed out because we are currently not, we haven't selected what we need to select to activate those areas. Below that is our tooth odontogram. Now our patient is 4, and so what we're seeing is all primary teeth. Now, there is a quick pick button that's super nice for pedo, and that is the 2 little people. So if you look at the toolbar up top, do you remember the 2 little people next to the little printer on the toolbar? Keep going over to the right. Keep going over to the right, right. Keep going right. Yes. When you click that, that is family members that are part of the same account. So go ahead and click that members drop down, and let's switch to child 1. Now, child 1 is 11, and do you see how the dentition is different? So the system, based on the age of the child, will auto-populate the dentition. So it's really important for the front desk team to make sure birth dates get put into the system so that we have our dentition defaulting the way we would want it to. Does that make sense?
Mm-hmm. Thank you.
Okay. So the next thing I want to talk about is a couple more things inside the chart. If you look all the way to the right, you're going to notice a tab that currently is blue and it says pre-existing. Then if you click the next tab that says completed, so it looks like tabs in a file folder, you would click completed, and then that one is going to turn to, do you guys have both pre-existing and completed as blue? Alice, do you know?
You know, I just saw that right now. Let me go ahead.
Usually those are different colors. Anyway, and then the TX, if you hit the TX plans, that one should be red. We'll soon find out. Perfect, that one is red. Okay, so what is it? We can have them be the same color. It is not a problem if pre-existing and completed are the same color. Some practices like to have them a separate color, just so it's really easy to tell what you did versus what you documented from an initial visit that someone else did. Again, it's up to you guys to have them whatever colors you want. That is practice specific. All right, so we're going to go to the pre-existing tab. The pre-existing tab is the only place where you will find conditions. So if we go to pre-existing, and conditions are things like decay, existing restorations that someone else did, the eruption of teeth, missing teeth, different types of conditions like fluorosis or stains. Those are different types of things that we're going to document. So what I want to focus on now is how we document those sorts of pieces of information in the patient's record, and also to change dentition if it's different from the quote-unquote standard eruption. So just because this patient is 10 or 11 doesn't mean that those canines are both in. So if tooth 27 is still a deciduous tooth, you're going to take your mouse and you're going to go near tooth number 27, but you're not going to click on any part of the tooth. Do not click any part of the tooth. Click outside the tooth, outside of the circle, but in the wide area. Perfect, you got it. So when you click there, you're going to see that it highlights the whole tooth. So I like to say it's the whole tooth and nothing but the tooth, because your options now, do you see how decay is not an option to pick, but missing or erupted is? So what we're going to pick is erupted. And when we pick erupted, we're going to say that what is erupted? Deciduous. So now tooth number 27 becomes R. So tooth number 27 is not in the mouth yet. We still have R present. Then I'm able to update single individual teeth. Now let's say that this patient is an early bloomer and C and H are both permanents. So what I would do is I would select C and I would select H, just the dentition area. Yep, no part of the tooth. Yep. So when I select those, and this time I'm going to click erupted and I'm going to place these as permanent. So that's how we can do more than one. As long as what you're doing matches, you could do the same thing. So if both teeth that you're selecting are primary, you can set them both to permanent. But if one was permanent and one was primary and you wanted to reverse that, you cannot do those at the same moment. Does that make sense?
Yeah.
Okay, perfect. All right. So now what I want to do is I want to go ahead and document that tooth number 30 is not yet erupted. So we're going to select tooth number 30 and tooth number 19. Neither one of them are erupted. And this time we're going to click missing, because it's not an eruption, it's an uneruption. So it's in a missing tooth because it's not present. So I'm going to click missing. And I'm just going to say it's an unerupted permanent. So I could have picked from this either unerupted, or missing altogether. There is a separate item for impacted. So if a tooth is impacted, then we would make the tooth present if it's not there, so that then we could click on it and mark it as impacted. All right, so the next thing I want to do is let's go ahead and document that this patient has some decay on tooth number B occlusal. So if you go over to tooth number B, the little circle, if you hover over the area of the circle, it will tell you if it's buccal, lingual, facial, mesial, incisal, distal, whatever. So we're going to select the occlusal, and then we're going to mark the button that says decay. So when you select the decay, this is documenting that the patient has decay on this tooth. We do not have a plan to fix it yet. We just know that it's decayed. Now, that is actual decay that we want to fix. If the patient has incipient caries, we can select two ways to do incipient caries. I believe you guys are going to mark actual incipient caries, but I want to show you that, and then I want to show you a watch. So if you pick, let's say that the distal occlusal of I and the mesial occlusal of J both have areas of demineralization that we want to kind of watch. And just two surfaces, it doesn't matter which ones you pick, it's fine. So on both I and J. And then you're going to click the conditions button. I need you to pick the conditions button. So when you pick conditions here, you can see that there is incipient, decay incipient here. There's also chips and fractures, cracks will appear under this because we selected surfaces. So when you click that, it's just going to turn black, which means we're kind of watching that area. And we know what surfaces exactly that we're watching. Now, if you put a watch on a tooth, you have to pick the whole tooth. So let's select the whole tooth and nothing but the tooth on 14. So when you go over to tooth number 14, you're not going to click on any part of the tooth structure at all. Perfect. When you select that, now the watch button becomes available. You're going to pick a direction. I don't care which one you choose because it doesn't really matter. And then grab that yellow arrow and drag it to where you want it to point. Do you see how tooth number 14 has that yellow arrow? Perfect. So then when you release the arrow, you're going to get a note and you can type why you put a watch on this tooth. Now, right now, we do have some notes that we can put on, like buccal, lingual, whatever, or you can just freeform type in the watch note. So go ahead and type something here in the watch note, something you would watch for. And then when you save it, you're going to notice that the only place that you see that information for buccal lingual is in the description. So there's a watch on that tooth and the description is buccal lingual. Does that make sense? The difference between an incipient and a watch? Conditions are what are changeable, and so is decay. So yes, those are in the settings, but it is the entire organization uses the same. It's not by office. Okay. Okay. So now let's go ahead and pick a couple. Let's go ahead and pick the root of R. Let's say this one has an abscess. So if you select the root of R, and you actually want to pick on the root, see how it grays out that area? So it knows that it's looking at a root condition. Now you can click the conditions button. And you'll see that your conditions button is going to give you a different list than you had before. So before, when we clicked on the conditions, it was surface conditions, and now it's root conditions. So there's an abscess as an option. And then it just documents that there's an abscess on this tooth. Does that make sense? All right. So now I want to document that this patient presented with a specific something from someone else. So if we select the crown of tooth number T, so go ahead and select on the crown area of tooth number T. And if this patient presents with a stainless steel crown, you're going to select the crown of the tooth. We're going to click the word crown. And now I'm going to be able to pick a stainless steel crown. And once you select stainless steel, then it's going to document that there's a little stainless steel crown on that tooth. Make sense?
Yes. So I have a question. So if it's 8 and 9 or one of the anterior teeth, and we offer the new smile crown, when we click on the crown of the tooth of E and F and we click on crowns, it's going to give us the option to choose the, not the stainless steel crown, but the new smile? Okay.
Yeah, that's all controlled by you guys as to what pops up under each of these buttons. So yes, the system comes pre-formatted, but yes, you can add it if it doesn't pop up, but it should. I believe the new crown, the new smile crowns are under that category.
Okay.
And I think they're called window crowns, but never. Or resin crowns. I'm not sure what the ADA calls them. I've been out of the loop for a little bit. Okay, so now we want to look at treatment plan. So let's jump over to the TX treatment plans tab. Perfect. So what are we planning to do? So if we're going to fill B, we need to select the surfaces that we're planning to treat. So let's plan to treat B. Because right now there's nothing treatment planned. So we'll have to select the occlusal surface. Okay, so previously you had selected a crown, and it's confused now because you had previously selected a crown of a tooth, and now you're picking a surface of a tooth, and so it says I can't do those two actions at the same time. So if you'll notice at the top of the screen where the tabs are, there is a thing that says clear selection. It's right under the restorative chart tab at the top of the screen. Hit that clear selection and it will take the gray off of tooth number T. So clear selection, perfect, because that was the last action we took. So now we're going to have to do a new action. So let's go ahead and click on B, occlusal. And we're going to plan a restoration. So we're going to click restoration. And then what kind of a restoration is this going to be? Is it going to be an amalgam or a composite? So this is just an amalgam. You'll notice you have two choices here. One was an amalgam and one was a redo amalgam. So based on the fact that you chose a primary tooth, posterior occlusal, it offered you what you could normally do for that area of that tooth based on the material that you chose. Now, if we're going to do sealant, so let's say we're going to plan for a sealant on 30 and 14. So you're going to pick the occlusal surfaces of 30 and 14. So you'll need to click on the occlusals of 30 and 14. Okay. Oh, sorry. 3 and 14. Ugh, I don't know why I was saying 30. 3 and 14. Dyslexic this morning. Okay, so tooth number 3, if you look at the circle, it has the split for the occlusal. So you're going to want to check both, select both halves of that, because those are, we seal the entire occlusal surface. So go ahead and select 30 and then 14. And then when we click restoration, perfect, you can pick sealant as one of the options in the drop down. And then it just puts sealants on those teeth as a treatment plan. Make sense?
Yes.
Okay. So let's say that you wanted to document the fact that today we also did an exam. So right now, if you go to the completed tab, you're going to see that although we've done a lot of things on our chart, we've not completed any charges. So if you go to the completed tab, it's the middle one. You'll see that down at the bottom, we don't have anything but the conditions that we charted. So we don't really have any completed services that we've done today. So we have what we refer to as explosion codes. I like to use the explosion codes under the treatment plan and then post them to Ledger after I review them. So I'm going to have you go back to TX plans. And I need to be able to document an exam, x-ray, and prophy. But when I look at my options, I have restoration and I have removal, bridge, implant, denture, and ortho. None of those are going to help me. So if you'll look over to the left-hand side of the screen, next you have the clear selection that you used earlier, last selection, and then there's an ADA codes button. If you click the ADA codes button, what you're going to see is that same sort of area that we looked at in the treatment plan versus quick add for our appointment. So this is a way that we can document things that we did today quickly and easily. So if you go ahead and go to the middle of this window, you'll see that it says add procedures by, and then there's the word code, user code, description, and explosion code. Do you see that section?
Yeah.
So your team is setting up codes that you use frequently. So if you click the drop down where it says select explosion code, there's a drop down in that bottom box. So it's in the middle of the screen. Yep, perfect. When you click that explosion code option, you'll see that there's a recall with 6 and 2. There's a new patient with 6 and 4. There's new patient with 6 PAs. So let's go ahead and pick whichever one you want of the new patient ones. And then when you click the go button, that's going to automatically treatment plan this for you. Now we're getting an error message. If you look at the top of the screen, it says, oh, I'm so sorry, I can't do this for you, because if you look at the background of your tooth chart, you still have tooth number 3 and tooth number 30 selected. And these codes are not tooth specific. So we're just going to acknowledge that and say, okay. Now hit your clear selection up above, clear selection, so that we have no tooth numbers selected. Now go ahead and hit your go button. So what the system did is if you notice at the very bottom of the screen, do you see how there's on the right-hand side, right before that big red area, do you see the little arrow pointing upward? It's a little tiny arrow in the lower right of the screen. There you go. When you click that, that's going to close the tooth chart and allow you to see your full treatment plan. So because we selected the new patient information, it auto grabbed the comprehensive exam, 2 bite wings, all of the PAs, the Child Pro, and the fluoride. So with one click in an explosion code, you were able to document all of that information. So with this patient's doctor of record is listed as Dr. Park, and because of that, all of the treatment is listed under Dr. Park as the provider. So you are the doctor for all of these services. Now, when you're ready to post to Ledger, you can use that little arrow so that you see a little bit more information again. So go ahead and click that arrow again to collapse the odontogram. And we're going to select the comp exam, the 2 bite wings, the PAs. So we're going to check mark, we're just going to single left click on those items that we're completing today. So we can just pick comp exam, bite wings, and pro if you want. We don't have to do all the PAs right this minute. So click, click, and then the child prophy, which is a second to the bottom. Now, if you want to select all of them, you can use your click. You can click one, use your shift key, and click the bottom one. It'll highlight everything in between. Or you can select multiple times. It's up to you. All right, now we're going to far right-hand side of the screen. Do you see where it says post? It's right in between new patient, new appointment, and delete. Yep, so when you click that post, what that does is it charges it out. So it's already in the ledger, and the front desk knows what to do. Now, this screen stops for you clinically, and this is important because it's allowing you to say, oh, this child needs a 3-month cleaning instead of a 6-month cleaning because their home care is terrible. So you would have the ability at this point to change the interval of when we recall them for any of these procedures. This is also important for your kids that are 13 going on 14. So right now they're 13, but when they come see you again next time, they'll be 14. We want to make sure that if their insurance requires us to charge an adult pro fee for Medicaid, then we want to make sure that that's what we document as what their recall is due for, is for that adult pro fee, not a child pro fee. Does that make sense?
Yes.
Okay. So 90% of the time, you'll just be able to save on this button. It's just those few occasions where you have to change it, that you can change it. All right, so go ahead and click Save here. Perfect. Okay. Now, if you click back on the, let's just go back to Charting New at the top of the screen. So charting, the charting drop down. And we're going to go Charting and Advanced Charting New. Perfect. Okay, so going back into the patient's record, there's one last thing that we failed to do. We failed to do what? So we've documented what we did. We documented what we need to do. What did we not do yet? A chart note. So you'll notice that one of your tabs in the upper left corner is progress notes. So we're going to do our chart note for this visit. So we're going to click on progress notes. So this P, if you were using the toolbar up above, it's the PN, not the little tablet. So PN progress notes. Now for this progress note, I can click the Add New Note at the bottom of the screen. So Add New Note. And then under the categories, so there's a diagnostic category, there's other categories that you could pick from, restorative categories, things like that. You're going to go ahead and pick exam with prophy. So then we're going to click Add to Notes, and then it's just going to say who's the doctor, and there's a drop down. So you would pick the appropriate doctor and who is the assistant who's doing the charting today, and then you would save it. So it's going to say who the doctor was, the prophy, the fluoride, the oral hygiene. So that's going to give you the information about what was done. So if you go like to the pulp stainless steel crown anterior, and you click on it, or posterior, doesn't matter. So the note, when you put it in, it's going to say remove decay, prepped, coronal pulp removed, isolated, rinsed with peroxide, acquired hemostasis. So if this is not true, if you rinsed with saline instead of Paradex, go ahead and click cancel on the tooth numbers for just a second. Perfect. So do you see where it says rinsed with peroxide? So if you actually rinsed with sterile saline, you could modify the Paradex. You could highlight it and say that you rinsed it with water or with sterile saline or whatever you rinsed it with. Does that make sense? So you do have the ability to edit what populates if it varies from what you did.
Okay.
And Allie, do you guys have signature pads yet? You're using signature pads.
Yeah,
Do they have them at this location?
It should be, it's plugged into that. Hang on.
Click this sign button for me again. Or clear and then sign. Down at the bottom. There we go. Now you should click the sign button, and now you should be able to sign it. Okay, so we got out of it without signing it. So let's go ahead and click back on the edit. And then from here, you could go ahead and highlight the sign button and then use that mouse to sign the signature and then say done. Now what we can do for the doctors, and I'm not sure, this is fairly new, so I don't think you guys did it in the past, but we can load the doctor's signature. It's under setup security user, and you can capture their signature with the signature pad. And if the doctor's logged in, she or he can go in and just click load my signature, which puts their signature into the note. If the dental assistant's logged in, they can add their username and password and sign the notes right over the side of the dental assistant. So either way, then you don't have to have so many signature pads hanging around. Does that make sense? Okay, so once the note is signed, if we were to say done, that would save the note and lock the note, so it would not be able to be changed once it's signed. So you're going to want to make sure your notes are correct before you sign them. That make sense? Now the tooth that you were looking up above, if this really was for a pulp and stainless steel crown, go ahead and click the little V next to where it says tooth. You could add a tooth number from that little V. So this will just let you select a tooth number. You can type in the box or you can pick a tooth, so whatever. And save. Okay, now save the note so I can show you what we just accomplished. So when we save the note, what you'll see is, do you see how it has that little pen in the column, which means the note is locked? So if we tried to edit this note at this point, it would not let us edit it because we locked it. But it does associate with tooth number 3. So go back to the restorative chart. And it's just a tab. Yep, restorative chart, perfect. And then select tooth number 3, the whole tooth. And then once you've selected the tooth, do you see along those little buttons right below the tabs where it says tooth history? It's kind of above tooth number 10 and 11. Tooth history, it's a button. Correct. When you click on that, what this does is any tooth that is selected, it's going to call out the first tab is all. You can filter to just pre-existing, just ledger, just treatment plans, or just progress notes. But because you associated the progress note with tooth number 3, it is identifying that as the tooth number, and it pops in this note. If we had failed to put the tooth number in at the top of the screen, then it would not have pulled this note in for that tooth. Does that make sense?
Yeah.
Okay. All right, so a couple of things for you guys. One is you can use the tooth chart treatment plan, but sometimes we want to make changes. So let's go ahead and close this. Let's say that you were the provider that was documented as the treatment plan, but when they come in, you're not there that day and somebody else sees them. So what the dental assistants would need to do is they would need to find the treatment plan sealant, for example. So let's click our little arrow up so that we can see our sealant teeth. So it's the little arrow in the bottom right corner of the description. So next to the big pink area, little pink arrow. Let's go ahead and highlight sealant on 3 occlusal. Just double left click it. So right now, you're the treatment plan provider, but if you're not here and somebody else does the sealant, we need to update the provider to the appropriate doctor who's going to treat that tooth today. So if you double left click on the sealant, that top one drop down is only used for when you're initially doing the charting. Once it's charted, you would have to double click on the tooth on this individual item and then click the treating provider drop down to change it. And then go ahead and save it. So when you look at the procedures you've got left to do, there are several, and that's going to be way too time consuming. This is pedo, we don't have time for that. So another option is to use the analog treatment plan. If you go up to the TX on the toolbar, it's a little tablet that says TX. And it's up on the blue toolbar. Almost there. Go to the left just slightly. 3 more buttons. Perfect. So when you're in the TX, you have the ability, if all of these were going to be done today by a different doctor, do you see down in the tan area where it says diagnosis date? If you check mark that little box right next to diagnosis date, it'll highlight everything in this list. So you can single left click them that way, or if you use the top one, then it'll highlight them all for you. Now there's a blue button that says provider. It's the 3rd one from the left. So up and to the right of where you were, it says provider. When you click that, you have the ability to update the provider all at once. So now you can pick the correct provider and then change, and it will change all of them at the same time. Make sense?
Yes.
Okay. Now, if you were completing the sealant today, you could go ahead and check mark the box next to 3 and 30, and you can complete it from here. You don't have to go back into the tooth chart. You can do it directly from the treatment plan. So they talk to each other, they communicate, and either one is appropriate to use. Whatever's easier for you guys, clinically. Okay. Next thing I wanted to talk about is a little bit of information about insurance plans. If you go to the house for this patient, When you're looking at the word primary on the right-hand side of the screen, it's the second section. It says dental insurance, and then it says primary. Do you see that part of the record?
Yes.
Okay, straight below primary, do you see where it says view insurance plan?
Yes.
That is, again, it's a blue hyperlink. So if we click that blue hyperlink, what that's going to do for your team is it's going to let you see some information about this plan without running all the way up front to ask a question. So when you click on the word primary, you can go to the benefits tab. So if you see BEN for benefits, perfect. This is just telling you that they have a deductible and they have a $1,500 max, and they also have ortho coverage. If we click the coverage tab, the COV, you guys can see that there is no deductible waiving on anything. So the deductible, if they have that $150 deductible or that $75 deductible, that's going to be applied to cleanings. It's going to be applied to sealants and everything. So they're going to have to meet that deductible before insurance will start kicking in based on this plan. It also tells you what percentages are covered. Now, the other one that we care about clinically is the limits tab. So if you go to the last tab, which says limits, this is where you'll be able to see if, now this plan has a bunch of things that say no limits, but most of the time these would say your diagnostic exam, periodic exams. Usually in this drop-down, it would say once every 6 months or twice a year, whatever that is. If fluoride is only covered once a year, it's going to say only covered once a year. Now, you've got molars. You've got sealants for the first molars. Those are going to be covered at up to a certain age limit, potentially. So we can say, hey, our posterior molar sealants are going to be up to the age of 13. So all of this information normally is filled out for plans so that you guys can take a look and see what that particular plan covers. So this is the California Ironworkers Plan. And even though they have Delta Dental of California, it may be different than the Joe's Diner down the street that has insurance that is covered by Delta Dental of California. So these are plan specific based on the patient's insurance. Okay, what questions do you have for me? I know we went through pretty quickly, but it gives you the ability now to kind of go in and explore.
Okay, so actually, you pretty much cleared everything as we were going. Well, I don't have a question for you.
I'm sorry, Tracy. Allie, are you there?
I am.
Hello? Allie, I'm sorry. Covina's phones are down.
Oh, okay. I'll call them.
Okay,
Or
so
I'll talk
if
to
there's...
Hazel. Yeah. I'll take care
Okay.
of it. Go.
Don't hang up though,
worry about
anybody. Okay. Keep on the phone, everybody else. Okay.
Okay.
All right.
Tracy, when you have a chance,
Okay.
once we're done with this, can I just have a few questions? Just me
Okay,
for
so we're done with the dental assistants, but we want to keep going with the front desk people. So don't leave me, front desk, and anybody who else may be working front desk at sometimes. I'm going to cover how to schedule, how to book appointments, and how to add insurance and how to add new patients and everything. So I don't want everybody to leave if you need this information. That's what I was, the only thing I was getting at. Don't leave. Okay.
Yes.
All right, so your two questions. Uh-oh, did I lose you?
No, we're still
No,
here.
we're still here, Dr. Park. Dr. Park, do you have any questions, Dr. Park? Do you have any questions? Okay.
Okay. And then do you need to write many prescriptions? Okay. So I want to cover that really quickly since you do prescriptions. And they're usually not controlled substance, right? Because they're just for the kids. Okay. So if you're writing a prescription, you're going to be in the patient record. So let's just go ahead and either click on the tooth chart or the house. It doesn't really matter. Just somewhere in this patient's record. Then do you see the little RX? It's right above tooth number B. Okay, if you click on that, then in the middle of the screen at the bottom, there's a blue button that's lit up and it says Add New. Do you see that one? Perfect. Now, we want to make sure the provider is correct. So the provider on the right-hand side of the screen, always make sure it's correct. It's going to default to whoever their doctor of record is listed as. So I would definitely encourage you to check that. And then your med is on the left-hand side of the screen. So you're going to pick whether it's your suspension or your tabs. So you'll need to make sure that you have all of the prescriptions that you typically write, that you give those to Alice so she can get those put in. Okay, so you cannot change the med, but you can change the dispense and you can change the SIG for that. Then, do you see at the bottom how you have a new button that says Quick Print all of today's prescriptions, or just print? So if you did multiple prescriptions, you could quick print all of them, or you could just singly print them. It's up to you. When you click on that Quick Print or Print button, either one, go ahead and click it. And then it should pop up the printer window. Did it not pop up yet? It's not popped up on my screen yet. I'm not sure where it's at on yours. Oh, the audio dropped, it says. We'll wait for that to come back for them. And then I wanted to run through the letters. So, can you guys hear us yet?
Yes, I can. Yes, yes.
Okay, so is this Dr. Park? Could Dr. Park hear us, or?
John. Dr. Park. Are they in the same over there?
John, Dr. Park. Can you hear Tracy? Oh, their audio dropped.
see that you guys are exploring the notes. Were you able to get the prescription printed? Oh, okay. Uh-huh. So typically we have signature pads in the operatory and we get the signature there, but they do have to be signed at the same time. Your second option is to go ahead and print it out, have mom sign it, and then scan it in with the doctor's signature. But once you save it as PDF, you cannot grab both signatures later. And is it in your state that the doctor has to sign it, or does just a representative have to sign it? Yeah, so this portion's only going to show whatever signature we capture at that time. Now you can print it with no signatures and then not save it as a PDF, and then it can be signed on paper, but then it has to be scanned back in. No, but they are working on it. I don't have a timeline on that one. Yeah, I would love to say next version, but I don't think it is. I would have to check though, because they actually slipped some things in this version I wasn't expecting. So sometimes if they can get enough time in, they'll do it. So. Okay, so as long as you guys are comfortable with printing the prescriptions, you can always go back to the RX. The prescription will still be there and you can print it. And then there's a couple of reports that you can look at during the day. So if you go up to the word reports daily, so at the very top of the screen, reports and daily reports. Then there's a missing progress notes. It's the last button in the second column. So missing progress notes. That will give you a list of all the patients who don't have progress notes but had an appointment scheduled for today. So, and you can run it by provider. Just go ahead and click print preview. Perfect. So then this is going to give you, because of the criteria on the right-hand side, it says show only missing progress notes versus show all appointments. It will tell you for this particular provider, we're missing a progress note and it's unsigned. Does that make sense? And it tells you the status of the appointment. So you know if they were set as inoperatory or if they were if they didn't show up or whatever. Okay, now the other one is unsigned progress notes, so it works the same way. It's just going to show you notes that will have been unsigned. The patient progress notes, which is the one above that, is going to give you a list of all the progress notes that were completed for a whole day. And then the other one that I recommend checking is in the first column, it's about the fourth one down, it's daily journal by provider detail. If you click on that one, and you would remove payments and adjustments, just because we want to just focus on charges today. So remove the checkbox for payments and the checkbox for adjustments on the right-hand side criteria. And then do a preview. And you do have the ability to pick a specific provider. But this is going to, I recommend when you guys are first getting started to run it for all providers, and especially if you're the only doctor in the clinic that day, I would run it for all providers just to make sure that nobody posted something to a different doctor that should have been posted to you. Does that make sense?
Yes.
Okay. Any other clinical questions that you guys have before we jump into the admin section? Is that a no? I didn't lose everybody, did I?
Oh.
Okay, and if we need to have a follow-up session, just let me know. And I am out of the office. I'm on the same time zone as you guys. Monday, Tuesday, Wednesday next week. But then Thursday or Friday next week, we could do a follow-up session if you need to, if you feel like you want to go over some additional items. Does that make sense for the clinical part? Okay. All right. Now, getting into the front desk. So, have you guys worked with the system at all that are going to be doing the front desk?
No, first time.
First time. Okay. So what I want to do is kind of start from the very beginning if you're adding a patient. So when you look for the patient, you guys saw, you were in on the first part, which was the patient search, right? The little search patient with the arrow pointing to the right. And are we on the right workstation to do the front desk stuff? Okay. Okay, so you remember how to search for patients. So go ahead and click that little arrow and type in a patient name and search for it. See if you find a hit. And you can just make up any name, doesn't matter. Okay, so this is looking for a last name, doesn't find the patient. So what we're going to do is we're going to click on the add new patient because we found that there's not a patient that matches the criteria. So we always want to look, and you'll notice your search in defaults to all locations and includes an active patient. So it's going to hunt for anybody that's a potential match. So we're going to go ahead and click add new patient. And from here, you're going to be typing in the last name. So go ahead and make up some test, whatever name, whatever you want. So that's your first, and it is a last name, first name. So the last name is Alice and the first name is Wonderland. So if that's what you want, it's okay. I just am asking. Okay. All right. And then you're going to put in a city, street, just your street, sorry. Your street, we're going to move to, we're going to skip the city, but. Now put in the zip code. By putting in the zip code, the system will automatically find the city state for you. So you just have to put in the street number, the street address, and then jump to the zip. And while you're doing that, I'm doing an online registration just so you guys can see what that looks like. Okay, so then we want to put in the gender of the child. Are they single or married? And then female or male. Perfect. Then this is that healthcare guardian box that we talked about where you could identify a specific healthcare guardian, like a family member who's not on the account but has access to the patient's health information. And then if you don't want to put anything there, you don't have to. In the upper right corner, we're going to select the relationship of this patient to the responsible party. And this is not what we're talking about for insurance. We're talking about who gets the bill. If the patient is not covered by Medicaid and they come in anyway, who gets the bill? So we typically don't put the child's name as the responsible party. It's usually an adult person that's the individual's name. Okay, so then we are going to put in at least one telephone number. Homework, cell, you decide, but it has to be one of those. Okay, then we're going to jump down to, do you see where it says cell and then straight across from that is a preferred method of contact? That preferred method of contact can be used for if you use Denticon for your confirmations, your appointment confirmations. So that's where they get that information of how the patient prefers to be contacted. Okay, so then the emergency contact, you got to see that earlier. Now we're going to jump to the left-hand side of the screen. So the first section is this patient active or inactive? That, if you remove that checkbox, that's what makes a patient inactive. If you select the assigned benefits to patient, the consequences of that are that if that is selected and the patient has insurance, as soon as you process your claim, it immediately closes the claim and puts all of the financial responsibility in the patient column, not the insurance column. Because this truly is saying, hey, insurance, you're going to assign the benefits to the patient and not pay us. Does that make sense?
Yes.
Now, the HIPAA agreement, you guys are not necessarily utilizing that. It's really up to you guys. Some practices go ahead and check that box because they want to acknowledge that the patient filled out the HIPAA acknowledgement or HIPAA agreement form. It's up to you guys if you want to check the box or not. Now, the no correspondence is also if you're doing like email campaigns and things like that, you can opt out. Patients can opt out of it with the no correspondence. It doesn't mean they're not going to get a statement if they owe money. It just means they're not going to get other types of correspondence. The next thing is going to be our coverage type. So if the patient has dental insurance, then we're going to put that they have primary dental. If they have dual insurance, primary and secondary, we're going to go ahead and put that they have both. And then it's going to be, we're going to check the checkbox primary and secondary. Now, when we do that, what the system's going to do is stop at the location where you would enter all of this information. So you want to make sure that you have that information available. If you don't have it available, you could say, okay, I'm going to come back and add it later. So you would not check the checkboxes for the insurance. Does that make sense? So in our example, we will say they have primary, and it's up to you if you want to do secondary. Okay, the next one is patient notes. If you'll type something in there that says this is a patient note or ABC, it doesn't really matter to me what you type, just some information. Then the next area is that HIPAA sharing. So go ahead and type John Doe is able to get health information or anything like that that you want to put in. Okay, the next thing you're going to do is on the right-hand side of the screen, it says office section. So that's the UCR. The office UCR is going to automatically populate for the fee schedule. The fee schedule that will be used, though, for patients will be their insurance fee schedule. So this is only going to take effect if they have actual insurance. So you leave that one at office UCR. You're not going to change it because the system will take care of it. Now, what we're going to put here is, are we putting patients under the doctor or under the corporation?
Come again?
Are we putting the this as the actual doctor that they normally see or under the corporation? Which way do you guys do it? Okay. Then the next one will be the referral type. How did they hear about us? Now, the refer to is only if we referred out, and for you guys, most of the time you're getting referred to, not referred away from. So the next thing I want to do is talk about the little red asterisks. Do you see all those little red asterisks that are inside of the system next to certain fields? What that does is it tells you that this system is requiring you to put this information in. And if you don't put the information in, it's not going to let you move forward. So we're going to go ahead and notice that the date of birth is not required. So go ahead and put a date of birth in. And then I want you to change the gender to unspecified. Yes. I believe it's a setting in the office setup that they just added. So I think it's an option, yes. Okay. So now what we want to do is change the gender to, click the drop down and see if you can put it back to blank. Please select, yep, click that. Okay, so if you fail to answer one of these questions like we're going to do now, we're going to purposely fail to answer the gender question, and you move forward, the way you move forward is clicking on responsible party. So when you click responsible party, not quick save, responsible party, that's going to auto flow walk us through. And see how at the upper left corner it says, please select sex? Because you didn't answer the question, it's always going to give you your errors at the top of the form. So it's going to say, hey, you're missing that. Now we need to add it. Now what the quick save does, I'm not going to have you use that because I want you to walk through the whole auto flow, and then we'll do another one with a quick save. But the responsible party, this double arrow, it says, okay, I'm going to take you to the next screen, which is responsible party. So this is going to let us complete our entry of the entire patient and setting up the account. So who is the responsible party? It can't be the patient because you see kids. They're not their own responsible party. So who will that be?
Their parent or subscriber to the insurance?
Yep. Yep. Whoever is going to get the bill. If they don't have insurance or they owe part of a bill, who gets the bill? That's what we're going to put there. Okay, so then in the right-hand side, you'll see there's an asterisk, so the responsible party is required. So are they an insurance account? Are they a cash account? Are they a Medicaid account? What are they? Perfect. Now we're going to go to, and you guys may want to have a hybrid account that says insurance and Medicaid, because if your patients could be covered by insurance and Medicaid, that may be an account type you want to add. All right, now we're going to go to primary dental insurance. And then that will walk us through putting in the insurance. So from this screen, the way we look up insurance, the insurances are held as specific insurance plans by employer or your Medicaids or whatever you would typically put. So let's go ahead and just look for a Delta. So let's do Delta in the top, and I'm going to show you how not to look usually. Usually you're not going to look this way, but I'm going to show you this one for this moment. So when you do Delta, it's restricting you because it's saying, hey, Delta's not a group. So if you look right below where you typed in Delta, see how it's defaulting to group? So you can say this is a carrier. So this is a carrier name is Delta. And then when you do a search, it should give you all the Deltas, Delta of California, Delta of wherever, but you still need to select the appropriate insurance. So if it's with Target, I'm going to pick the plan 153. If it's with U-Haul, I'm going to pick that plan. Now see how Gilead Science Inc. has two plans? And they're both matching. So we probably have a duplicate plan that we need to condense. But there's the second possibility is that this particular employer has two different plans. They have the same group number, but one pays a higher benefit than the other. So when you see that blue hyperlink for the text, you can click on either 140 or 141. And what that's going to do is it's going to bring in the information about that plan, and then you can click on your plan button, your benefits button, and your coverage button to make sure that you have the right plan. Does that make sense? Because one may be a $2,500 plan and one may be a $1,500 plan. So by selecting that button, you can then close it and pick the one that's correct. Now, once you've decided which one is the appropriate insurance plan, you're just going to click the select button. That's what puts it into the system and links it to the patient's record. Now, the last thing you want to do is you're going to notice that your patient is listed as the spouse. And since you only see kids, they're probably a child, not a spouse. That would be my guess. Because this is how is dad, mom related to your patient, Wonderland Alice? Does that make sense?
Yes.
Okay. So now what we're going to do, excuse me, is we need to put in the subscriber number, the subscriber ID. And then you also have the ability to put in a plan effective date that you can put for the plans that have conditions that don't allow coverage for anything but cleanings for the first year or something. So you have the ability to set all that information up based on the plan. Okay, now we are going to go ahead and move forward to the secondary insurance. So now we're going to do secondary insurance, and this time I'm going to look for my Medicaid. So what is your Medicaid plan called? Okay, so Denticon, and there's your Denticon. So you're going to grab it, select it, and now this time the patient's insurance is not mom and dad. I'm going to have you leave it, and we're going to come back to this in just a second. Go ahead and put in a subscriber ID. So go ahead and put in an ID number and a date of birth, because those are both required and we don't have either one of those selected. Okay, so now we're just going to go ahead and save, and I'm going to show you what happens if you move forward with bad information. So add medical information. This is where you can put in their health history. They can fill it out on paper, and I'm also going to show you an online option so that you can see how what happens when patients fill it out online. So you can see how much faster and easier this will be. So go ahead and say no to all medical alerts. We're going to pretend they filled it out on paper. And then if they actually, you noticed, oh, guess what? They do have a medical alert. They have an allergy to penicillin. You can just check the penicillin checkbox Y and add that. So either way, it works great. Okay, now we're going to move forward to the add recall. And this allows you to enter a recall date. So if they're being seen today for recall, and you really don't have to put that in, but if they're being seen today for maybe a emergency, a limited, you want to get them into your recall system, then you would want to put in a recall date. So it's up to you. By habit, we just put in a recall date 6 months from the day we created the account, but you guys may have a different protocol. Up to you guys. Okay, now we're just going to go ahead and finish. Okay, so you have created an account, but when we created this account for the secondary, the information, we did not put it in very well. So we're going to click the secondary, and I don't know why I didn't do the box because I should have, but let's click secondary. And this Denticon plan is actually the patient. So see where it says select from list? We're going to put the patient, we're going to drop down the patient's name. So we're going to pick Alice as the person who holds the insurance. And what's Alice's relationship to the subscriber? Well, since Alice is the patient and Alice holds the insurance, she would be self-insured. Now, her relationship to the primary subscriber. So mom, dad is the primary insurance holder, so she's the child of them. Does that make sense to everybody, what that's asking? Okay. And then we need a subscriber number because it dropped it because we changed who the insured was. Okay. Now, what I want to show you is that's how it should look. When we come back into this next patient, I'm going to fix a couple of things and show you some options that we have to add another patient. But what I want to do is, if you'll notice up at the very top of the screen, where it says patient information, there's a new button. There's a little button that looks like the next one over. So the next one over is our HIPAA. So when you hover over it, you can see that John Doe can get health information. When you look right above the medical alerts, that's where the patient note displayed, where you put testing patient notes. So those are places that will be displaying based on the fields that you select or enter on that main screen. Does that make sense?
Yes.
Okay. All right, so now the next thing I want to do is I want to talk about if patients do an update to their health history, you can request that they update those online. And when you do that, that information gets pulled in automatically to the system. And what happens with those is it updates both their medical history and their patient information. So let's go to our recently accessed patient charts. It's a drop down. It's right next to our patient lookup window. And it's the little circle with the double arrow pointing downward next to the search patient. So that's our window that says, hey, these are the patients that you've recently accessed. And what I would like you to do is pick child 2. And when you go to child 2, you're going to see that there's a new icon next to patient information. Do you see the little globe with the person? And it's red. That's telling you that you sent the patient an online, you requested them to go online and update their patient information. So there's a symbol that says change in demographic and medical alerts. And when you click it, the system's going to show you what's been changed. So oh, your pop-up's blocked. So in your upper right corner, can you unblock your pop-ups? Always allow and done. Okay, go back to the house, and then we're going to come back in. Sorry. Okay, go back to that symbol. So what you would normally see is this little box that pops up that says, okay, this patient had a change in demographics. And on the left-hand side, it shows you the current values. And on the right-hand side, it shows you the updated values that they updated online. So you can see that the patient didn't update their email address. It's not going to drop that. It's just going to bring in the elements that have been changed. Does that make sense?
Yes.
Okay, so go ahead and update, and that will grab all of the updates that the patient made and put them into the account. Now, the next update that they made was, we're just going to wait for just a second, and that'll disappear. The other update they made was an online medical history. So do you see the blue button at the top that says import online medical history? It's right above medical alerts. It's a blue button. When you click on that, it imports the new medical history form and allows you to save it. So go down to the bottom of the screen and save, or update, whichever it's telling us to do. Update. And then that's going to keep that new medical history. Now, do you see the drop down that says medical history as of 4/5/2019, 11:28 a.m. Pacific? If this patient had filled out their original health history form in the past, and then we got an online update, we would have two forms. The only reason we don't have two forms today is because I just added the patient today. Does that make sense? So it was just an update to today's information. Okay. Now I want to go back to the house. And when you look at Training Child 2, they live on Starlight Way. But if you switch to Child 1 in the same account, so the member, either way you want to pick it, that's fine. See how they live at Tooth Fairy Lane?
Yes.
So each patient truly can have different addresses, but normally we would want everybody in the family to have the same address, right?
Right.
So I don't want to sit and type this 5 times. If they gave me an update for one address, I want to be able to copy that to all members of the family. Make sense? So what we're going to do is we're going to go back to Training 2 because Training 2 has an updated address, excuse me. So if you click the button next to the patient ID that says Edit, so go over a little more to the right. Yep, perfect. When you edit here at the bottom, do you see the screen that says Update Addresses? It's a blue button, very bottom left of the screen. Update Addresses.
Calls may be recorded for quality and training purposes.
Please enter your access code followed by the pound or hash sign. You entered no digits. Please re-enter. To enable audio controls, please enter your audio PIN followed by the pound or hash sign. If you do not have a PIN, just press pound or hash.
Sure. Hello. Okay, so in the bottom left corner, do you see where it says Update Addresses? When you click on that, a box is going to open up and say, okay, based on this patient's information, what are you copying to everybody else in the family? So you uncheck anything that you don't want to have updated. And you leave only what you do want to have updated to update. So if the subscriber has a new update, then we want to copy that subscriber's information to the insurance, for example, so that it updates it on everybody. Go ahead and click Update. And then Save. And then when we go back into Child 2, then we'll see, Child 1, we'll see that the address is updated for everybody in the family now. So now they all have Starlight Way. Make sense?
Yes.
Okay. Perfect. All right. So the other option is to have patients register online. That's going to save you guys a ton of time. So let me show you what that looks like when the patients register online. So if you go to the button that looks like a globe and it has the number 1 next to it, this is right under the office name. And it's a globe and a person, and it has a number 1 right above it. Perfect. Okay, so this is where we see the name of the patients who have done online registration. So the minute the patient saves their online registration, this information appears in your screen in the form of this alert that says, hey, this patient has filled out an online registration. So when that happens, we have the ability to click on the print, highlight the patient's name, and you only have 1, then click the print registration. And when you print the registration, you're able to see if this patient is has a family that's already been you can determine who they are, what family they belong to, and decide if this patient should be part of an existing account or if we should create just a whole new account for them. So when we do that, what we're going to do is go ahead and look at that information. Now, if you go to the appointment book, what I would like you to do is go ahead and go to the schedule. I want to show you how to book a new patient appointment if you're going to give them an online registration thing to fill out. So what you're going to do is you're going to double click on the time slot. Pick any time slot. It doesn't really make a difference which time slot you pick. It can be any. Then it's going to say, okay, this patient, see how it has add a new patient for the last person we worked with, which was child 1. See that radio button at the top of the screen?
Yeah.
If you click that, that's who you book the appointment for. The next button says add new appointment for training family. And if you click that radio button, you're going to see that it offers you all of the people's names that are part of that same family. So go ahead and click on the next radio button. Add new appointment for training family. Yep. And then it shows you both of the training kids. Now the next one is existing patient. If you click the existing patient button, that allows you to hunt for a patient using the search. The next one is a new patient. So if somebody calls up today and they say, I'd like to book an appointment for my child. They've never been there before. You've confirmed they've never been here. What you're going to do is you're going to add them as a new patient placeholder appointment, and then you're going to ask mom if she will fill out online paperwork for you. Does that make sense?
Yes.
Okay. So this mom has agreed she will fill out new online paperwork for you. So go ahead and add, click the add button for this new patient. Perfect. And now the last name is going to be training. First name is going to be kids with a Z. So first name is kids, K-I-D-Z. And the screen hasn't quite caught up, so I'm not seeing the first name yet. You may have typed it, but I don't see it yet. Sorry. And did you guys already type kids for the name?
Calls may be recorded for quality and training purposes.
Please enter your access code followed by the pound or hash sign.
Calls may be recorded for quality and training purposes. Calls may be recorded for quality and training purposes.
Please enter your access code followed by the pound or hash sign. You entered no digits. Please re-enter your access code followed by the pound or hash sign. You entered no digits. Please re-enter your access code followed by the pound or hash sign.
Calls may be recorded for quality and training purposes.
Please enter your access code followed by the pound or hash sign. To enable audio controls, please enter your audio PIN.
Hello. Okay. So in the first name field, will you type kids, K-I-D-Z, for the first name? In the first name field, if you'll type kids, K-I-D-Z. Perfect. And then tab over to birthday, or you can click in the field. Either way you want to do it, it does allow you to tab. So the birth date is 05/01/2010. Perfect. And then the home phone number is 602-777-88888. So 777-8888. Perfect. Now make your duration longer than 10 minutes, because our appointments probably are not 10 minutes long for the duration. So the first, and then the box just to the left of the duration is what type of an appointment is this? And I think you have new patient as one of those options, but I'm not 100% certain. Okay. Now, you can put a note in. Mom's going to fill out online registration. The notes go in that note section just right where your cursor is. Correct. And anything you type here will be visible from the appointment book. So it's nice to be able to put notes in that you need in this field. You could even put in insurance information if mom tells you what the insurance is or anything like that. Okay, go ahead and save. Now what we're going to do after you save the appointment is we're going to actually create that online registration patient. So let's go back to the main application, and there's two ways to get there. You can either click the house, or do you see your Chrome symbol down at the bottom of the screen, that red and yellow and green and blue circle? If you hover over that, it will show you all of the windows, and you can just grab the main application window, which is the third window from the left. Perfect. Okay, so here is our patient. Mom filled out the online registration, so everything's great. You now see that the mom filled out the registration, and you're going to go ahead and register this patient. So what you're going to do is you're going to notice that you've highlighted the patient, and then on the right-hand side of the screen, you have two choices. You can register the patient and a responsible party, or you can register the patient to an existing responsible party. So that's where the family already exists, and they're just adding another dependent to their account. In our case, they've not registered before, so we're going to do a whole new account. So at the bottom of the screen, we're going to click Add Patient. It's going to confirm that you're sure you want to add them. We're going to say OK. And now you're noticing that there's a whole bunch of information that's already been populated. You don't have to type in their name or their address or anything because the person already did. You do have to watch for your mandatories. So patient's relationship to the responsible party, they forgot to put child. So you will have to pick anything that they didn't do. So we're just going to go ahead and click the drop down for relationship to responsible party on the right-hand side of the screen. It's the top box. Perfect. And we always have to put in the preferred provider, so the house doctor. And that's in that section. You got it. You're right there. Awesome. And then in the upper right is the patient type. This is where you can put patient types if you want, but they're not required. But you could put, hey, exactly. You got it. Okay. So now we're going to do our walkthrough, which is next to go to responsible party. So we're going to click responsible party. Now, the only thing I have to fill out here is the account type. And I noticed when I did my print preview, I didn't print it, but I saw that they had insurance. So I'm going to change this account type to insurance. And then I'm going to move forward to primary dental insurance. Now, the system was able to find this patient's insurance. They have California Iron Workers, and we already have that plan set up in our account. So you'll notice that the system automatically located what it thinks is the plan. And then you can click that blue hyperlink to double check. If you happen to close this window, hit close. On the right-hand side, at the top of this little window, hit close. See how it's sitting at the top of the screen, though, right above your cursor right now? So you can always review what they put because you can see it up there. And then hit search again, and it'll just pop it back in. So search on the left-hand side. You just have to hit that blue search button because it's already populated everything for you, and then you're just going to highlight it and select. Now, they already gave us all the subscriber information, so now we're just going to move forward to add medical information. And they already did all of it, so there's nothing we need to do except move to add recall information and finish. So you can see how much of a time savings it is when the patient fills it out for you. Does that make sense?
Yeah.
And we clicked finish, correct? Click the house for me. All right, let's search for this patient because it should have brought them in. I don't know why it's not finding them. It normally takes you right to that page. So let's look up training kids. I'm not sure if there's something going on with the WebEx or whatever, but training, K. There it is. So you can just click the hyperlink and get into their account. Okay, so this insurance, I purposely put in a bad piece of information because I wanted to show you this do not disturb symbol. Do you see that next to the word primary, how there's an error telling you something's wrong? If you hover over that little symbol, it will say patient name to subscriber doesn't match. So you're going to click the primary and look at it to see what's going on, what happened with this. So when I click primary, I can see that it says mom training is the insured. In the upper left corner, it says kids training is the patient. So that is clearly not self. So down at the bottom where it says relationship, you're going to change that to child. And then save. And that will get rid of that symbol. Does that make sense?
Yes.
Okay. Now we have one more step to take, and that is linking the appointment to this account we made. So let's go down to our Chrome symbol and look at today's schedule. And we're going to see that we still have a new patient. Now, when you look at the new patient, see how it has a white box with a red N inside of it? Next to the scheduled. Their patient type is new. If you click on this appointment with a right click and go to, so right click, go to, you'll see that everything's grayed out. You can't go to the patient overview because as far as the system is concerned, this is a new patient placeholder and they don't have an account. Does that make sense?
Yes.
When we booked the appointment, we said they were a new patient. So what we need to do now is we need to edit the appointment. So go ahead and click edit on the appointment. So it's a 2 times left click or a right click edit. Okay, perfect. Now, do you see in the middle of the screen where we would normally save, do you see how it says add patient? Because it knows this is a new patient. When you click that, you're going to acknowledge, yes, I do want to add the patient. So go ahead and continue. But instead of adding them all over again, say okay. What we're going to do is we're going to click the check patient button. Do you see the blue check patient button above the name?
Yes.
Click that check patient button, and what it's going to do is it's going to find any name matches. And now all you have to do is link the appointment. So that changes the appointment from a new patient placeholder to linking it to this patient who filled out their online registration. So now when you look at the patient overview, you'll see the patient has an appointment, and now it lost that little red N for new patient. So now if you right click, it has a patient overview to go to. Does that make sense?
Yes. What is the called? The one through the appointment. If you go back to the schedule, what is the link again when you right click on the appointment? Oh,
to see everything. It's an edit, or the link to go to the patient overview is the house, or you can go to any of these places. You could go right to the treatment plan, right to their transactions that we charged out today. So you can go anywhere with a right click, just about.
Okay. Okay.
Now the other one that's going to be important for you guys is the digital imaging. We're trying to get Denticon Web hooked up so that you can take images inside of the cloud application. And you can bridge right to X-ray from this patient's appointment by clicking Launch Denticon. See where it says Launch Denticon? So you could go right in and look at their appointment. It's not linked yet, but that's where you would be able to go in the future, and you'd be able to find that patient and those blue buttons at the top, print X-rays, select the series, and you could look at X-rays. You could forward them to another office. You could print them, whatever you need to do. Does that make sense?
Yes.
Okay. You don't have that yet, but you will have it, and there will be a training on that directly with the X-ray training staff. And then if we need a follow-up, Allie or Alice, let me know, and I'm happy to do a follow-up with your team. But they have a new trainer that's a hygienist, and she's really good. She's really good. So I think you guys will be impressed with her. Okay, now we want to complete an appointment for today. So let's go back to our schedule. And the doctor saw that patient, child 1, I believe, is the patient who had transactions done today. So if you click on this, you're going to set the appointment as checked out. So you're going to mark it as H for checked out. And when you double click on the appointment, it just opens the appointment. So just close it. Just click the close button in the middle of the screen. Okay, so right click and set to checked out, or single left click and click the button. Perfect. Okay, so when you check a patient out, it immediately takes you to this screen called transaction entry. The $ is exactly the same as transaction entry, but it allows you to see what got charged out today. So you'll notice that this patient that we have, they have $50 that they have to pay towards their comp exam, and then insurance is going to pay everything else. Do you see that? So that's based on the fact that they had a $50 deductible that they had to meet. Do you remember that when we looked at the plan overview?
Yes.
So if you discover that this patient was a new patient today and you didn't really learn how to get rid of the fact that they have a deductible met, you may have to fix a specific transaction to correct it. Does that make sense?
Yes.
Okay. So the way we correct, and I'll show you how to fix it in the first place, but I want to show you how to correct it for now. So if we didn't update their deductible, but they already met it at another office, we know that because we did a benefit breakdown with the insurance, so we know what their status is. So based on that information, this deductible should not apply because they already met the deductible when they went to a general dentistry office before they came to us. So we're going to go ahead and click on the date hyperlink on 4-5. So the date hyperlink that's next to the comp eval. Yep. When you click on that, it opens up the transaction and allows you to fix it or correct it. So our fee is $95. If you click the button that says advanced, it's blue and it's in the middle of the screen of this window. Perfect. When you click advanced, what you're going to do is you're going to see where it says deductible. So then the section just below where you're at is the override insurance estimate or change billing order. So if we want to estimate that insurance is going to pay in full, we're just going to zero out that deductible. And then we're going to save it. When we save that, the system's going to say, hey, are you sure you want to do that? Because according to the system, they're supposed to have a deductible. We say, yes, we want to override. And then, oh, did we save it? Maybe you don't have permission. I guess I should have checked that. This user may not have. Now, did you save it? Yep, okay. Oh, sorry, I didn't have you do all of it. We removed the deductible, but we forgot to change the fee. So go to the advanced, sorry. So estimated insurance is going to be $95 in the primary column because we took off the deductible, but we have to tell it what we want it to do after we took off that deductible. So that's going to be $95 for the charge, and insurance is going to have a zero deductible, and then we're going to save. Perfect. So now it's all going to the insurance. Make sense?
Yes.
Okay, do you ever have a situation where the doctor gives something away for free? You have to charge zero for a fee or not send it to insurance for some reason?
Yes.
Okay, so under that same area that we were, click on the fluoride and click the hyperlink for the date on the fluoride. Let's say that we didn't want this to go to insurance for whatever reason. When you click that advanced button, you can say that it should not go to insurance. So the billing order is in this lower section, and it's about 2/3 of the way across. Perfect. Change the billing order to none. Say, okay, I'm sure I want to do that, and then save it. So what that does when the billing order is none is it puts it all in the patient responsibility column, or you could have zeroed out the fee or given a discount or a write-off if that was your protocol. But see how that line item is gray and everything else is blue? So highlighted versus not highlighted. And it's missing in the bill column the D. So what we've told the insurance, we've told the system is this does not have insurance coverage for it. I don't want to send a claim ever. So we have removed the insurance from this transaction. Does that make sense?
Yes.
Okay, so that's how we would stop something from going to insurance. So now, if the patient was going to pay you for this, or if you were going to do a payment to write it off, do you see the middle of the screen where currently we're in add procedures, but we can move to the payments and adjustments? So there's a tab that says payments and adjustments. Perfect. Now, if you were taking a payment, you could click on the payment type, cash, check, credit card, whatever, and select it and apply money. So let's go ahead and say we're taking cash for $10 of this. So you can put the $10 in the apply column. Since there's only one item, the system will automatically apply it to first in, first out. If there were multiple items in this list, then we would need to select the exact place we wanted to put the money. Okay, so we've applied a $10 cash payment towards these services, and now we're going to write off the rest. So click your adjustment type radio button under the payments and adjustments section. Perfect. Now we're going to give a courtesy discount. So grab your courtesy discount. And it's at the very top. There you go. So when you select courtesy discount, this provider isn't the provider who did the discount, who we're giving the discount on, because the provider who completed the charges for the fluoride is a different doctor. So we need to switch to the house, which is the provider who has the transaction. Whoops, pick the house doctor instead. Go to your provider at the bottom and change it to the house. Yes. See how now the transaction shows up? When you're giving adjustments, you have to identify the provider who's going to get the, I don't know that we want to call it a hit, but they're going to get their production reduced or their collections reduced because of that discount. And so we need to make sure that we assign that to the appropriate provider. Does that make sense why you didn't see this charge before? Okay, so now let's say that we are going to write off $10 of it or $15 of it. You can put the amount in the amount column, or if you're going to write off the whole 37, you can click that checkbox to select. So there you can type in the amount you're in. You can type in the lower right corner of the screen under new amount. Or if you check mark it like you just did a moment ago, then it assumes you're going to pay it in full, and it will put the full amount of what's remaining to be paid. Does that make sense, the difference between those three actions?
Yes.
Okay, now go ahead and put a note. This is a note, and then hit apply. Or ABC, whatever you want to type in that note section. And then apply. Perfect. Okay, so now when we look at this, we see that the cash payment is a different color than discount, so it's super easy for us to identify the discounts that have been done. And see the little N? If you hover over that little N for note, you'll see the note that you typed, discount. Does that make sense?
Yes.
Okay. I know I'm at my limit of time, but there's a couple of other things I wanted to show you, and one is the ledger. Alice, are you going to be with them when they go live, since you've used the system and have the other trainings?
Yes, I am, Tracy.
Okay. So will you be able to show them how to look at the ledger and everything?
Yes.
Okay. And we can look at it really quick here. It won't have as much detail. And then the other thing I didn't get to today is processing insurance claims. Now, I could do that with you guys probably on Tuesday morning. I think the clinic I'm at, they start a little bit later. So what I can do is I'll send you my schedule, and then you let me know if you want to meet with me before or after work from the clinic I'm at on Tuesday. Okay?
Okay.
Because I just want to touch base with you and make sure that everybody's good and they don't have a lot of questions.
Okay. Perfect.
Does that make sense?
Yes, it does. Thank you.
All right. Thank you, everybody. I know there's a few gaps, but you will have awesome people with you, and they've gone through the training and used the system before, so you won't be left out in the cold.
Thank you.
All right. Thank you. And I have not heard, Allie, on those licenses. I did run a check last night. You might have gotten an email on that. So I think they've got those ordered. I just am waiting for that status. So you should hear from them today, I imagine. Okay.
Thank you.
Perfect. Thank you. Have a great day, everybody.
Likewise.
Okay. Bye-bye.
Bye-bye.